We talked a lot about how irritable bowel syndrome, impacts patients' quality of life significantly. What are some things that they can do to be active participants in helping to improve their quality of life?
Thanks, Dr. Shapiro. I think that when I see patients, that's really my number one goal, is to improve their quality of life. We know that irritable bowel syndrome doesn't decrease the quantity of life, so it doesn't increase mortality. But if your quality of life is suffering, I think that's so much more important to a patient in the here and now. Lifestyle modifications really do help in many patients with irritable bowel syndrome. And so when I say lifestyle modifications, what I mean is that kind of common sense steps that we take to improve our quality of life in general can also improve our IBS symptoms. And that doesn't always make a lot of sense to patients, like why would increasing my sleep quality also improve my IBS symptoms? But there is a true link between those, for example, and not discounting those steps that will improve your quality of life, in all the realms of your life, I think cannot be overstated. So for example, getting some good quality sleep, as I mentioned, getting regular exercise, and also taking care of your mental health. And so that link between the gut and the brain is so strong that if your mental health is not addressed in some way, then it will also make the irritable bowel syndrome symptoms more difficult to treat. And so, kind of looking at like the quality of one's life in entirety, not just from a GI standpoint, I think is really helpful. From other practical considerations, creating a symptom diary to maybe help pinpoint your worst symptoms and IBS triggers can be really helpful. Sharing that with either a dietitian, your mental health provider, or your healthcare practitioner may be very helpful. Meeting with the dietitian to create a more personalized dietary plan can be helpful. And again, if you have an underlying mood disorder, treating that in tandem with your IBS symptoms can be really helpful. So treating your IBS symptoms may help your mood, and treating your underlying mood disorder may help your IBS symptoms. And there's a lot of other great sources of information that are out there, but oftentimes the internet can be really overwhelming, scary, and often inaccurate. And so if you're interested in learning more about irritable bowel syndrome, we'd recommend to use very reliable sources like the IFFGD.org.